Cool. Thank you. This looks really good. You're a good model.
Thank you.
Good. Moving opposite arm, opposite leg, keeping those cues, neck long, chin tuck, chest wide, ribs down, not flattening the back against the floor. Moving opposite arm, opposite leg, slow and controlled. Good. Awesome, awesome. Good. Let's do one more. Good. Cool. How'd that feel?
Good.
Good.
I think like the arms or legs separate, it's easier for me to keep the breath
Yep.
the same as when I'm still. That was the hardest one.
Yeah. Yeah.
Obviously, yeah, because you're like cross bodying. Yeah.
Yeah. Yeah. A little bit more coordination and I guess effort. Yeah. Because you're now.
Yeah, like thought about, yeah.
Yeah. Exactly.
Thinking about the breath.
Yeah.
But no, that actually felt really good. I think like if I had tried to do 10 more, like I would have been fatiguing. Like I was just like starting to fatigue, so that was a good time to stop.
Good. Awesome. Yeah.
But
yeah,
that feels really good. Yeah.
Yeah. I'm not trying to like put you in certain positions for too long.
Yeah.
But I'd say as you're working on these on your own, like obviously you challenge yourself and kind of try to work on that endurance a little bit more. But those look good.
I like feel where it's a good time to stop.
Yeah. It's kind of finding where your baseline is and then progressing from there. That's good. All right, so now we're gonna come into quadruped. So we're gonna come into like all fours.
Oh yeah.
So we're keeping knees under hips, wrists under shoulders, pushing the ground away from us. So not to allow that mid back to collapse through, keeping those cues, neck long, chin tucked, cinching those ribs down, not allowing, this kind of stomach to drop. And then from here, I'm just gonna do a couple breaths, get that position. And then from here, we're gonna do the same thing that we were doing like on your back. So we're gonna start to move one arm overhead, back down, other arm overhead, back down. Still trying to keep those cues the whole time. And think about, if you have like a glass of water that you're balancing on that lower back of yours, like trying not to let that move. So again, really trying to keep that trunk super, super stable. Good. Still working on that breath. Good. Nice and slow and controlled. Good. Let's do two more. Good. And then let's start to move our legs. So same thing, we're keeping that 90-degree bend in the knee, and we're gonna think about moving directly from this joint in our hip. So it's more of this kick, kind of like heel up towards the ceiling.
Okay.
There you go. So it's more, like pure extension of that hip joint. Good. Yeah, just like that. Good. So try to angle to like not completely straight backward, kind of like back into the side.
Okay.
Kind of at like that, maybe like 35-degree angle.
Okay.
Yeah, better. That's it. Oh, it's better. Yep. Just like that. Good. Keep that breath. Keep pushing the ground away from you up top. Yep. Keeping that slight bend in the elbows too, so you're not locking out those joints. Good. Balancing that water on your lower back. Yep. Good. Let's do 2 more. Good. And now can we move opposite arm, opposite leg?
Yeah, we'll try a couple of those.
Yeah. There you go. Good. I'd say even go a little bit shorter. You don't even have to go that far. Go like right, yeah, right there. Come back down. Good. Very good. 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 Let's do 2 more. Good. Cool. All right. Take a break there. How'd that feel? Okay.
Really good, yeah.
Good. Definitely a little bit more challenging, but
Yeah, I think like maybe you've already like changed this about you in your own head, but for me it's like having been an athlete, you want to always do speed work, but it's like I understand now like slower is better.
Yeah.
Like in general, but like especially for this part of like
I
recovery
think
for me.
it depends. Yeah, it depends on your purpose. Like, what are you training for? Like, obviously, like at a high level sport, like field, like that's how you train for the success of that sport. Versus this is just like, yeah, you're training for something different. So like the training's gonna look different, and like the movements that you're gonna do are gonna look different. So it's not like, yeah, I know what you mean though. It took me,
You know what I mean? Yeah.
to like,
And even when like Jeff and I do like, I don't know, lunges or squats, just like randomly around here, I'm like, Jeff, like just slow. Like the slower you go, the better it's actually gonna be for your body. If you're just like doing squats like this, like you're really not getting a lot out of it.
Yeah.
Like it's that conscious thing, like, okay, slow
right.
for the form.
Right.
Like, yeah.
Versus just trying to like speed through something just to get it done.
Yeah, like faster crunches are not better. Faster push-ups are not always better. Like
exactly.
Like, I think part of it is like retraining my brain a little.
Yeah. No, it's that athlete mentality of like, yeah, you're always feeling like you need to be like dying to feel like you're doing any work.
Yeah. Or like more reps or something. Yeah, like more faster.
Right.
No, but that feels really good.
Yeah. Awesome. No, I'm glad. Yeah, I know. It's definitely been like a pretty big mindset shift in my own mind. Even like when I'm working with people that are athletes and do have like a sport, and I think it's and I can see it because I'm just like, I thought the same thing. It's just like you feel like you have to like be dying and I don't know, like in pain to feel like you're
like falling on the floor sweating.
So just trying to show that you can still get a lot out of like slow controlled movements. You're not really maybe like sweating or building a lot of heat, but you can still get a lot of you can still get a lot out of it. And I think you still feel good, you function better, you move better, so that when you do go do those things, like you're more likely not to get hurt, and you're like reducing your risk of, you know, maybe creating an injury because you just have a really good baseline now. So
exactly.
Yeah.
Cool.
Awesome. Let me show you one more thing. So we're gonna come from quadruped into a tripod position. So we're pretty much gonna bring one foot outside of our hands. And then from here, we're gonna come upright.
Okay.
And then come back down, back to quadruped, tripod, upright, come back down, quadruped. So we're just shifting kind of in between a couple different positions. But again, trying to keep those good cues the whole time.
Cool. See if I can get situated here. Okay.
So again, yeah, when we're transitioning from quadruped to tripod, like think about also, yeah, that glass of water on your back that you're trying not to allow to spill over.
Okay.
There you go. Yep.
That was forceful.
Yep. And then pop up. Yep. There you go. Back down. Ah, I hear Natalie.
She'll be happier when she's here.
Yeah.
You want to come hang out with us? Come on. She'll like this one because I'll be right in her face.
Yeah.
Hi, lovely lady.
Hi, Natalie.
Oh, who's talking? Ooh, she smiled.
You hear me?
I feel like I already know this one. I have the most trouble with, like, and maybe it's just because I'm on carpet. Like,
Yeah.
Picking the foot up and not like picking the whole hip up.
Right.
So yeah.
Yeah. It's kind of working on that trunk stability, but adding in the hip mobility without compromising trunk stability. Yes. So it is a little bit tougher. Yeah, that transition.
Should my toe be tucked or down?
Tucked. Start with the tucked. Yeah.
Hi, ladybug. Hi, ladybug. Okay. Yeah, push away. Because I definitely twist there. That's what I noticed.
That's okay. Yeah, again, not looking for complete perfection, but doing the best we can to keep those cues the whole time. Good.
Hi, Miss Natalie Rose.
Good. Try to think about keeping your knee directly under your hip. I think you're kind of shifting your body weight forward too much. Does that make sense?
I think so.
Better. There you go. There you go. Good. That looks better. Yep. Good.
You happy now? You happy now? Yeah, you are. Good girl.
Good. Good. All right, let's do one more. Good. Actually, how much does Natalie weigh?
12 pounds.
Okay.
I do squats with her.
Yeah. Okay. I was going to show you something you could probably use if you want to use her for your resistance.
Yeah.
So yeah, you can hold her. I'll just use my coffee cup to kind of show, but we're going to start in, this like kneeling position. And then from here, come to half kneeling. And then you can use her to like push out, kind of like do this like press.
Ooh.
Back. Here again, press. And again, trying to keep like everything above the pelvis as stable as possible. And we're just moving our hip. So you're going to have to be quick with it when moving your
Yeah.
leg.
Maybe I'll try 2 without her.
Yeah, try 2 without her first.
Just to be sure.
Yeah.
If I don't use her, where should my hands be? Can they be up here?
I'd say by your side or wherever is comfortable. But I'd say if you're not using weight, to actually use more of your arms. Yeah, kind of like a runner's. Yeah. So you're kind of like, kind of like opposite leg, opposite arm. Kind of like you're going into like a sprint.
Yeah.
Yeah.
This one feels good though.
Yeah. Mm-hmm.
Feels like, like total. Okay, that was a bad one.
That's okay. Good. That looks good. But doing the best, to kind of land in a position where, your foot is underneath your knee, with the leg that you're bringing forward, and then the leg that you're grounded on, you're keeping, like that knee directly underneath your hip. And then everything else above the pelvis, super stable. So you're really trying to not move too much. There you go.
You want to try this one, Natalie? You want to try this one? Hey, buddy. Let's try it.
You just hold her close to your chest, and then you can kind of like.
Okay, baby, ready? See if she's good up here. It's just about getting her tucked in. Okay.
Yeah.
I don't know if I can really. Wow. Maybe we'll just keep her close.
Yeah. That's good. Probably makes it a little bit more challenging, to balance yourself, but good.
What do you think, Natalie, honey? Pretty good? I guess the key would be she can be a cue for me, like keep her stable.
Yeah. Like keeping her as still as possible.
What do you think? Are you still? There you go. Say hi to Shannon.
Look at Natalie go. Good. Those look really good. Awesome.
Sometimes I feel like my left is better than my right. And I know it's from hockey.
Yeah.
Because you're always stepping with your left foot.
Right. So lots of compensations from
yeah. From like a one-sided sport kind of.
Absolutely. Yep. Yeah, I'm trying to think. We led with your left leg. Yeah, I'm wondering. I feel like I have a lot of problems like on the left side of my body. It's like my left shoulder, my left neck, like my left SI joint, my left knee.
Dang. Yeah, totally could be from that.
Yeah.
Probably is.
I wouldn't be surprised. I would not be surprised.
Just years and years of playing, not just college level.
Right. Yeah. Good.
What do you think, Natalie? She's watching you even though you can't see her head.
Hi. Hello. So cute. Good. Let's do one more. Good.
Yeah, she's good resistance for that.
Yeah.
We'll build up to pushing you out.
Awesome. Yeah. Good. Cool. Let me just show you one more thing that you can work on in that tripod position as well. Or I'm sorry, that half kneeling. So I'll try to come back further. Okay. So yeah, trying to keep this position, foot underneath knee, hip directly above knee. And from here, we're just going to work on kind of sending the butt back, coming back through.
Keeping trunk long.
Keeping trunk long, yep. And really, again, trying to move directly from the hip, not like bending the trunk. So it's like we're shifting just from this joint.
Okay.
And then eventually we can work on kind of adding foot cues. So as you send the hip back, you're pushing into your big toe. And then as you come forward, extending, you think about pushing your heel, kind of like imagining like a wall here. So even like doing this against a wall could be helpful. Oh, I don't know if you can see. This has a little bit of a ledge, but we're thinking about pushing our big toe into the floor as we send back, but then pushing your heel into the wall as you come up. Does that make sense?
Yes. Let's see how you do, Natalie. Oogie boogie. She might just roll towards you, Shannon.
Hello.
Let's see what we got here. Okay.
Yeah, so trying to keep those cues above the pelvis, neck long, chin tucked, chest wide, setting your breath. And again, thinking about just moving that hip joint back towards the pelvis. Good. You can add a little bit of trunk flexion, like you can bring your, body forward. Yeah, there you go. Just very slightly. Trying to keep those hips square so you're not rotating.
Oh yeah, this is gonna be the hardest one for me. Yeah. I'm gonna do this with my arms, I think.
Yeah. Yeah, this one's definitely a little bit tougher. It's really trying to isolate that hip. Really work on like centrating that hip joint. Like, what are you doing? Good. Still keeping that breath. I would say also try tucking your tailbone slightly.
Okay.
Yeah, just so you don't over arch that.
Oh, Natalie. You pooping?
Oh my God.
Yep, that's a poop.
Oh, that's hilarious.
She felt it. Am I tucking? Sorry. Can you see me enough? Should I move it?
Yeah, no, looks good. Good. Let's do two.
Fatiguing my quad. Should I be fatiguing here? Because I'm
You might. You definitely might. You definitely might.
Am.
Yeah. Yeah, really try pushing into that heel as you come forward. It might be, difficult to coordinate like in the beginning.
I think I need something. Hold on. A little something on my knee. This feels a little better. That's way better. Okay.
Yeah, that's fine.
Natalie! Poo-poo, it's double. Okay.
Good. Yeah, that looks good.
Yeah, just a little bit elevated and cushioned, felt a little better.
Yeah, that's fine. Yeah, I'd say as you get better at like centrating that hip, I don't think that there should be as much pressure into the knee. I think it's just, yeah, some of these are starting to try to figure out how to balance one another out.
Right.
Good. Let's do like 2 more on this side and then let's switch. Good.
What do you think, Natalie Rose? Gonna wiggle you a little bit. There we go, baby. A little more. This one's maybe harder for you to see. Okay, let me get myself square. Gotta get square, Natalie. Square, square, square.
Good. Good. Slow and controlled.
Serious, Natalie? A triple?
Someone's gonna need a change.
Yep. She's been a little backed up, so I'm not sure why. So that's good. It's a good thing.
Yeah.
Okay, I got the heel thing now, I think.
Yeah. Yep, big toe as you sit back, heel as you come through. You should, as you push into your heel, like you should feel like your glute, hamstring, kind of more muscles in the back.
Okay.
Good. Good.
Shannon.
Oh, Shannon. What's up, Shannon?
Hi, Josh.
How are you?
How are you?
Oh, hanging in there. Doing
Yeah.
good. Yourself?
Hanging in there.
Good. Stay
Hanging
healthy.
in there. Staying healthy, staying safe.
She's been
Good.
shopping for Instacart, like doing the shopping.
Oh, yeah. That's the new thing, right?
Yeah.
She's a shopper.
Oh, you're the shopper.
Well, I've actually used it for both. Yeah, like when I was working a lot, I was actually ordering my groceries through that because I never had time to actually go to the grocery store. But
Right.
now that I have lots of time, I'm like, you know what? I'll switch the role. I'll be the shopper now.
That's pretty sweet. So
Yeah.
you like just go and shop for like other people's orders, basically?
Yeah, pretty much. Pretty much. It's not bad.
Yeah, fancy. Very cool.
Not bad. Make a couple extra bucks here and there. Can't complain.
Absolutely.
Yeah.
Especially in these times. Yeah.
Absolutely.
Look at that. Look what mommy's doing. Yeah. Look what mommy's doing. Whoa.
Good.
Woo.
More.
All right, let's get back to it. Nice seeing you, Shannon.
Yeah, nice to see you, Jeff. Good. Awesome.
Yeah, I figured it out on that side.
Awesome. Cool.
And again, it was left foot forward.
Yeah, all good. Awesome. All right. I guess we'll call it there. I think those look good.
Just want to recap with you what you need from me. Do you want me to pay you on Venmo?
Oh, yeah.